Good afternoon. It's the 12th annual BC Air Quality and Health Workshop put on by the British Columbia Lung Association. My name is Veda Peters, one of the educators with the Lung Association, and I'm here with Dr. Michael Brauer from the School of Population Health at the University of British Columbia. And we're going to talk a little bit about policies for public health and the AirCare program. What was it? Why was it implemented?
So the AirCare program is what's called an inspection and maintenance program. This is a program where cars are tested for their emissions, and it's really got two main goals. One is to identify the high-emitting, the high-polluting vehicles on the roads. We know that a very small proportion of the vehicles actually contribute most of the motor vehicle air pollution. So to identify those vehicles and repair them, or to actually remove them from the fleet. So it's one of the ways that we have to basically accelerate the turnover of the fleet of vehicles that we have to replace the older, more polluting vehicles with the newer vehicles, which are much, much cleaner in terms of their air pollutant emissions. So AirCare was started in the implemented in Vancouver in the Lower Fraser Valley, so Metro Vancouver and the Fraser Valley regional districts. Started in 1992 and just ended this past December 2014. So it's a 22-year program, and it had several different phases where there were different sort of restrictions on the types of vehicles that are required to be tested and their allowable emissions.
And how could AirCare program, what mechanism would it use to affect health?
Yeah, so what we're trying to do is actually see if there's a link between AirCare, which was designed to improve air quality, and did that actually result in improvements in health. So the approach really would be that AirCare reduce vehicle emissions. By having cleaner vehicles on the road, we would get lower levels of air pollution throughout the region. And that would then result in improved health measures such as reduced mortality from cardiovascular diseases. And as we can see from the data, we did see over the period that AirCare was implemented, we saw reductions in vehicle-related air pollution. We also saw reductions in measures of, for example, cardiovascular mortality over this same period. The challenge, though, is really making the link between this program and the health improvements that we've seen over this period.
So whether or not there are other factors.
Right, and so as I mentioned, one of the goals of AirCare is not just to identify the vehicles, but also to accelerate the change of the fleet into getting these newer model year cars on the road more readily. So we know that let's say the emissions from one older car accounts for the emissions of 15 or so newer vehicles. So the technology was changing. Over that same period, also the population was changing. So we've had an increase, for example, in visible minorities. We know in Canada that immigrant populations tend to be healthier than populations that have lived here for a while. So perhaps that is related to improvements in health. We've also had other changes related to lifestyle. Smoking rates have decreased. So all of this is sort of happening at the same time, and we're trying to tease out the signal from AirCare. And that's important because these types of programs, even though ours has ended in this region, there are over 50 regions in North America that have similar programs. So this is one of our main ways to implement regulations on motor vehicle air pollution. So what we've seen in our analysis, we've done a few different approaches. One, we've compared the AirCare period to before AirCare, both in our region, and then we've controlled for other trends, these same kinds of trends by looking at other regions, Calgary and Victoria as sort of control regions. And what we see is that while there's a little bit of noise depending on which region we control for, that we do seem to see a consistent decrease in the cardiovascular mortality comparing the AirCare period to the pre-AirCare period. And we've seen this actually throughout the 3 different sort of phases of AirCare. In addition, we've been able to see relationships between the level of air pollution as it varies from day to day or month to month, and the number of cars that fail AirCare. And the assumption there is that if a car fails AirCare, when it comes back to be tested, within a month or so, it has been repaired, so the emissions are lower, or the cars have actually been removed from the region because you're not allowed to register your car if it hasn't passed AirCare or if you haven't repaired it. So we see a relationship there that the more cars that fail, shortly after that we see a improvement in some measure of the air quality. And very interesting also, we have 2 strike periods, 2 periods during AirCare when it wasn't functioning. And at those times, we tend not to see those improvements in air pollution. So that's sort of another interesting signal. And then looking at sort of the health impacts, we see it's a little bit more complicated. I would say the signal is not quite as clear, but through some rather complicated statistics, we are also able to see some signals in that the more failure rates, sort of the reduction in cardiovascular mortality over this period.
So overall, has AirCare had an effect on the policies that we have with regard to motor vehicle transportation?
So since AirCare has ended in our region, I would say when it was implemented, it was quite effective in removing those highly polluted vehicles from the roads, and again accelerating that turnover of the vehicles. Now the concern would be that because there's no testing, that for example, you can bring in a highly polluted vehicle from another region. You can hold on to your car longer in this region. Perhaps we're going to see some backsliding in the pollution levels. We had, as was seen over this period, seen improvements in air quality. That's at the same time that we've seen huge increases in the number of motor vehicles. Now, without that check on the sort of the quality, what's coming out of the tailpipe of the car, we're still going to have that increase in vehicles, and we may see some backsliding in air pollution. So that's sort of the concern for the future.
I see. Well, food for thought, insights that I hadn't really considered with regard to AirCare, having had to put my car through it on a number of occasions. But I thank you very much for your participation in the workshop.
My pleasure.
Thanks, Dr. Brauer.
You.